Okay, thank you. Resilience rests fundamentally on important relationships. It is best promoted by ensuring the well-being of primary caregivers, of those who take care of the children or adolescents, both at home as well as school. So this includes teachers, counselors, advisors, and so on, coaches. Like children, this is again in the National Academy study, Vibrant and Healthy Kids. Like children, these caregiving adults here, they too need that same steadfast, dependable support to be doing okay themselves, despite ongoing adversity, which God knows all of us have experienced in spades over the last couple of years and continue to contend with. My work is when I said moved on to caregivers, community-based work with primarily mothers because they're primary caregivers of their children most often. The beginnings of this work was the early 2000s when I was still in the faculty at Yale Psychiatry Department. It was called Relational Psychotherapy Mothers Groups. It's a 6-month program meant for mothers with histories of serious addiction, as well as comorbid psychiatric disorders. That's the reference down there for you. Offered in methadone clinics. So the idea was not to have to call them in separately to attend groups, but while they were at the methadone clinic, and we provided daycare also for their children, the groups would happen on site. The goals of RPMG were to provide ongoing support, as I said, for these women, treating them as human beings and not just women with serious, very serious psychiatric histories and even current problems. So give them ongoing support while promoting positive parenting. We found after the first 6 months, significant improvements in the stress that would include depression, stress, so on, self-reported. Interestingly, parenting behaviors as reported by the kids too. So this is not just mom's report of their own parenting. It's the kids' reports as well on mothers maltreating behaviors, which, as I'm sure you know, is something that is particularly problematic among those of us who struggle with depression or substance use. Those kinds of things are related to maltreatment risk, and the fact that we were able to bring this down was, to us, very meaningful. Also, reductions in substance use, and once again, substance use was measured by urinalysis here, not just self-report. So RPMG was mentioned in this study, a consensus study, as well as this is a newer intervention, but a similar, how should I say, conceptual basis. It's called Moms Partnership, developed by a woman called Megan Smith, who used to be at Yale. I'm not quite sure where she is right now, but it's a terrific program, 8-week program for under-resourced mothers. And they offer this in places like laundromats and grocery stores, where literally meeting these moms where they are. Once again, just like our PMG, these were support groups intended to reduce depression, improve management, stress management, as well as parenting behaviors. I think there was more of CBT kind of skill training in the Moms Partnership program than there was in our PMG, but the underlying the framework, the scaffolding of both these interventions was very much relational and supportive of mothers. And I think Megan is now offering these moms groups virtually too. I don't know the details, but I'm sure we can find out if we try. Just one quote, this from one of their papers, Power of Social Support that delivered in group settings. Participants, this is what's most important for me, experience empathy through connections with other moms. Very much, again, part of this and part of what our next intervention involves, which is authentic connections groups for moms who are healthcare providers. In about 2013, when I first came to Arizona, developed this intervention that was a spin-off of our PMG, also for mothers, but in this case, mothers facing a different kind of everyday adversity, if you will. These are healthcare providers at the Mayo Clinic in Arizona. And I'm sure you know that, or you may not, that risk because of this huge burden of caregiving at work as well as at home. These folks are at pretty high risk for depression and so on, and certainly burnout at work. So instead of 6 months, this was 3 months, weekly 1-hour sessions on the hospital campus with protected time by administrators. Again, very important. They didn't have to come early or stay on late to be in these groups. Led to substantial improvements in self-reported distress. This is again, the burnout at work, which of course for Mayo, the administration, and for the women themselves is really important because burnout reduction benefits the institutional in terms of turnover and loss and so on, and not just obviously the physicians and providers. Once again, fortunately, we've had this not just self-report measures, but even with the stress hormone cortisol, the findings reflected this steady improvement over time among Authentic Connections groups moms as compared to control moms. And the beauty was that these gains that were there was, there were increases in the 3 months, but after the 3 months were over and there was the 3-month follow-up period, the gains were even more, how should I say, the slope was even more stiff, in other words, steep. In other words, the improvements were greater 3 months following the close of the interventions. Which to me was fascinating because it really meant that what we have tried to put in place, which is connections among these women and between them and their what we call their go-to people on the outside, all of these had been crystallized so that the group leaders, facilitators became superfluous, unnecessary as it were, and people got to depend on each other in real life. So they had their safety networks, their support networks there. And one thing I'm very fond of saying is, good psychotherapy helps, but nothing heals like love in real life. And that's essentially what these women got to experience. I should add that 2 years later after their groups, 2, 3 years, 4 years later, after their groups finished, these women are still in touch, many of them, on a monthly basis, bi-monthly basis, with the text chat and so on. So this is stayed, it's kept. Second trial was for nurse leaders at Mayo headquarters in Minnesota. And similar improvements. This is probably the single thing that thrilled me the most. There wasn't a single dropout in any of these trials. In fact, to date, I don't know that anybody has dropped out after the first session or two when they know what's required and what's so on. We have had no dropouts in Authentic Connections groups. It's another lovely thing for me is that, like in this group, Sherry Chisak at Mayo, the woman who ran the groups there, once again, this has now become in-house, right? So that I don't have to provide the facilitators. Sherry was one of the nurse leaders at Mayo. She and a colleague of hers ran 2 groups. Within their groups, each of their groups, there were several people, several women or moms who were themselves able to have the aptitude for and the interest in running groups themselves. So now we have these 2 women, they've got 3 each, so the 6 more being trained and supervised so that they too can run the intervention with the manual and looking at fidelity and so on and so forth. So what I think of this as developing wellness from the inside out, and it's not helping an individual to get well, but to help infuse and grow a positive institutional climate. And that happens when all these people are themselves absorb this positivity, if you will, that comes from each other. It solidifies, it crystallizes, and then spreads out into the institution. Just a couple of quotes for you. This is from the first study. The groups have helped me connect with colleagues in a way I have not carved out for myself previously. It's a warm, inviting, safe space, and I can feel my blood pressure drop even as I start to walk toward the meeting room. I don't know about you. I'm a mother myself. Thankfully, mine are grown now. But as you were as I was a professor, a young professor, and I had little kids at home, the level of stress any mother who's sitting in this room or father can identify with, that there's just so much going on. And now, of course, with COVID, so much more. So this notion of having a safe, comforting, inviting, embracing space was to all the moms extremely valuable. Here's a quote from Sherry's group at the Nurse Leaders. It's a chance to take time to be cared for, to be held accountable in seeking support, as opposed to endlessly giving, and it helps build that new network of support that I mentioned. Fortuitously, before COVID hit, I had published a paper with a couple of my colleagues on virtual AC groups. These were the 5 sets of groups with both clinicians and educators. And this time we had women with and without children. Again, across all 5 sets of groups, we had no dropouts. Average satisfaction rating was over 9.6 out of 10. So what this tells you is there's an enormous need for this sort of thing, certainly among the population we've dealt with so far. This is the article. It's in Development and Psychopathology. Happy to share all these papers if you like. National Academies has now specifically, in the same report, they have specifically recommended AC groups given the low cost and ease of access from moms' own workplaces, homes, and even while traveling at conferences and such. These virtual groups might be considered a useful model to be explored in future work with moms. So again, National Academy says you want kids to be well, make sure moms are well and other caregivers, but right now we're focusing on moms. For moms to be well, they need these groups and they can be accessed from on the road. Virtually, you don't have to be within your institution going to a group in a particular place. Besides science, this is a PBS maybe 8-10 minutes feature on AC groups, which they came to my home to film me running groups with virtually as well as in person. It was, I think, broadcast nationally last year or so. For me, what this says is that it's not just the scientific community to whom the group spoke. It resonated with women in the lay public, which is why these journalists picked up on it and said, this is something we'd like to spread the word about. During COVID, I did a bunch of ad hoc groups for healthcare providers, school administrators, counselors, and teachers, and interestingly, men as well. So men don't gravitate quite as easily to an authentic connections group for men but I reached out to a bunch and they did come and they did attend, and so it can be done. It maybe needs a slight amount of tweaking, but it can be done. I ran one group for just men and then one for men and women, which was the counselors, and both were pretty good. Once again, as I was explaining earlier, the big benefits, not just the benefits for these individuals themselves, but what they were able to take back to their communities and spread from their meetings. I just wanted to mention here, I know, Anthony, you work with folks in this demographic. I have become extremely preoccupied with this, working with these folks, retirees, grandparents, people on the verge of retiring, empty nesters, people in assisted living communities, retirement communities. There is so much, I don't need to say this, you all know, so much loneliness, or so much loneliness that it speaks to my heart. I feel like this is something we need to do systematically, and to bring such groups to these folks so they do not feel that sense of isolation, do not feel that sense of waiting for someone to call. Reminds me of this Joan Baez song that I used to listen to when I was in college back in 1978 or so. It's called Hello in There. Some of you may have heard it. It's, if you spot some hollow ancient eyes, please don't stare. Say hello in there. Basically acknowledge us. We're here. Speak to us. So I'm very, very preoccupied with this. If any one of you is interested in any groups, not just these folks, but moms, dads, teachers, counselors, please be in touch. The model in institutions, there's 2 ways in which I'm thinking about it. One is within institution. What I've done is brought clinicians and the staff together, groups that were normally siloed, and also, like within a boarding school, for example, helped the new staff members integrate into the community. And this helped create this overall climate of caring. Across institutions, like the counselors group, for example, or the group I did one for school heads, principals. These are very beneficial across the institutions because fewer concerns about confidentiality, which they would have had there been with people from their own school or institution. Now, it's not so much in medicine. We find more of this in schools. It's interesting. I'm not sure why, but anyway. Participants in these groups were learned new coping skills and relationships building skills that they spoke about sharing with others, and they were replenished themselves in their role as those who give, so to speak. Why now focus on this? Just a small piece of data and a very alarming piece of data. 2020, serious levels of burnout were reported by almost 1/4 of faculty and staff. By now, the rate has gone up to almost 3/4, that's 72%, I think now it is. So we're not talking about little burnout, we're talking about red zone burnout. If our children are going to schools where the educators are 3/4 of them, or 7 out of 10 of them, are reporting this kind of level of exhaustion, we have a problem. So I'm really focused on trying to grow the reach of groups in schools. Also, rates of support, high support requested of these school-based adults has increased from 13% to 32%. And this variable here is strongly linked with the stress. So our recommendation is provide more support while addressing workload issues. And for me, it's this upstream approach. Always start with the people who routinely support many others in their everyday lives in their community. So upstream prevention approach. Next steps, what do we need? Adults who take care of others must themselves be taken care of in an organized, proactive way and at an institutional level. So as I said, I ran many of the groups over first year of COVID, almost all were pro bono, but as time went on, it's a little nonprofit we have, so I had to bring in some money, and it was professional development funds that helped to support the groups that we did subsequently. And the message that we tend to give in recruiting is these are people who are widely seen as pillars of mental health, and how the benefit, as I said in the previous slide, they develop new coping skills that they can share with others, as well as relationship building skills, and ensure that they themselves get support. Very important clarification: AC groups are not self-care. This is not about put your own oxygen mask first, but make sure there's someone who can put on your mask for you should you need it. Should you be gasping, as I have gasped over the last couple of years with all that's gone on. So make sure that there is somebody around. You've got your safety net, your people. So just to summarize, this community-based approach to foster resilience, institutions must use this upstream approach, deliberately supporting those in empirically validated ways to support those who routinely give to other people, filling up those people again. These benefits will have a ripple effect in building positive institutional climate. And as I mentioned earlier, this sort of from the inside out, it begins to build and sustain itself. That's it. Anthony, can you hear me?
Sorry, I'm muted. Thank you, Suniya, for that. If there are questions in the chat, please feel free to place them. Looks like there is one question here from Charlie Izzo, who writes, you mentioned that one mechanism through which AC groups had beneficial effects was by infusing more positivity in the climate within the institution. Was that based on formal assessment of organizational climate, or was it more based on anecdotal information?
In the first couple of clinical trials, it was not their assessment of the institution, but we did assess comfort received and closeness to colleagues and so on. So moving forward, the numbers are not large enough in a particular institution, but that's a very good question. And we shall move toward, in schools especially, where they've begun to do this as a whole school-wide initiative, we shall be looking at that. It's a good question.